In patients with darker skin types, you have to use a conservative approach. So whether you're doing chemical peels, whether you're doing lasers, or even with your topical regimen when you're treating hyperpigmentation, you need to be conservative. So in my practice, for example, we'll talk about chemical peels. I'll start with the lowest concentration and then titrate up. So if I start with the salicylic acid peel 20%, I might do that twice before I go up to a 30%. I also ask for patient feedback. So if the patient said they had a pretty deep peel or they had significant redness or they had a bigger response than they typically have, I might not go up in the concentration, or I might drop down from a 30 to a 20%. So it really is paying attention to your patient, listening to the feedback. When you're doing your procedures, paying attention to the skin and looking for any significant inflammatory response while you're doing the procedure, and just overall using a conservative approach. It's better to have to do 2 or 3 extra procedures to get the desired benefit than to be too aggressive in the beginning and end up with unwanted side effects. When I'm treating my patients with darker skin types and I want to do cosmetic procedures, I choose these procedures based on how safe they are in darker skin. So the safest ones that I do personally in my practice are chemical peels. I do laser for hair removal, which is perfectly safe in all skin types. I'll do lasers for acne scars, and the one I use is a non-ablative ND YAG, which again has an excellent safety profile in darker skin types. And then skin tightening and devices for fat are also safe in darker skin types. So all of those things can be used, and we actually have now a lot of options for darker skin types and patients with skin of color. The things we want to stay away from are the ablative lasers and really anything at aggressive settings. And I forgot to mention microneedling. I think that that is something that's relatively new that offers our darker patients with acne scars an excellent treatment option with a good safety profile. When I'm treating hyperpigmentation with topical regimens, I also use a conservative approach. I think that sometimes we think, oh, it's just a topical, they'll do fine, but I find that a lot of patients can get irritated by retinoids, hydroquinone, and all of the other things that we use to treat hyperpigmentation, and my goal is always to keep the skin calm through my entire treatment regimen. Whether I'm doing a procedure or even a topical approach to treating hyperpigmentation, the skin has to be calm. So I use a lot of topical steroids when I'm treating hyperpigmentation. Sometimes I'll add hydrocortisone at night. I'll tell patients, if you have any erythema, if you have any significant dryness or irritation, hold off, skip a few days, add some hydrocortisone. Sometimes people ask me, how do you approach the patient with melasma? And that is something that is it's a great question, and it's actually very complicated. Melasma patients sometimes feel like there's a simple peel or a simple cream that they can use and get rid of the melasma forever. And it's really important for those patients to understand that melasma is a chronic condition and there's no simple cure. There are great treatments that can control the melasma and get it under control, but there's not one simple quick fix that gets rid of melasma forever. Once patients understand that, and they understand kind of that we're in this together to get them better, I have much, much better results. So the first thing I emphasize is sunblock and sun avoidance. I tell my patients, we could get your skin almost completely clear, and if you go out walking in the sun for 10 minutes without sunscreen, it will come 100% back. So once I understand the importance of strict sunblock and sun avoidance, that is a huge obstacle that we overcome to getting their skin better. The second thing I do with melasma is that I really focus not only on fading the hyperpigmentation, but also on keeping the skin very calm. Because if you're using an aggressive topical regimen that's irritating, then you sometimes don't get the efficacy that you're looking for. So the goal is to manage efficacy, being as aggressive as possible without irritating the skin. How I do that is I often add in hydrocortisone 2.5%, so prescription hydrocortisone at night to some of my melasma regimens. And I tell them to use it if they have any irritation from their topicals, if they have any erythema, but also if they get a tremendous amount of sun during the day, more than their typical day. My goal is to keep everything calm and soothed, because we know with melasma, any irritation can kind of aggravate that process of making more pigment and making the melasma worse.